All right. Again, we thank you so much for being one of our Meals on Wheels volunteers as well as a My Phone Buddy volunteer. We are truly grateful that you have taken time out of your day to sit in with us for the training. Please know that your role as a My Phone Buddy is essential in reducing the isolation and loneliness of our senior clients. As you know, since you deliver, you know your people and you know what they have going on. You know that many of them are experiencing some isolation. So we appreciate you actually giving that extra service, not only delivering meal, but also serving in this capacity. Um, all right. This is going to be rewarding for both you and the seniors that we serve. So please know that. Next slide, please. Now, as the program overview, the My Phone Buddy connects our Meals on Wheels clients, as you know, with volunteers with a quick and friendly phone call. And this helps break up the isolation and loneliness. This program supports the independence of our most vulnerable population, seniors who are aging in place. And additionally, the program aims to conduct wellness checks to ensure client well-being. I know for me, as you know, my as I'm getting older and I think about it's like, okay, I want to be able to remain in my own home. I don't want my children telling me what time to go to bed, what I need to put on, or what I need to eat. So many of our clients are the same way. They want to remain in their homes. And then with your you providing the extra check along with delivering their meal, it allows them to do that. And they have additional support to help them remain in their home. So again, we are truly grateful for that. Now, the clients are at least 60 years of age or and older. Many of them are disabilities. So some of them may be slow to answer the phone and may have difficulty hearing or have some other obstacles that make the conversation difficult for them. So we ask that you communicate clearly and just be patient and friendly we know that you will be.
Okay, my name is Taisha Jones, and I am the Senior Client Services Coordinator here at MIPha. And I am going to jump on here and explain the importance of social interaction. According to the National Institute on Aging, the health risks of prolonged isolation are equivalent to smoking 15 cigarettes a day. Regular social interactions significantly reduce feelings of loneliness and it improves mental health in our seniors. 1 in 4 older adults in the US express that they have feelings of loneliness. So, addressing loneliness is not only important for our emotional well being, but also for maintaining brain health. Social engagement strengthens those connections in our brains. And without regular social isolation, those connections can weaken. And when they weaken, it can increase the risk of dementia with our clients. These statistics highlight the importance of the work that you all do as a buddy. So, with consistent, meaningful engagement with your buddy, we have a chance to curb some of these hard numbers. And I'm going to show a little video just to reiterate how important it is for social interaction.
The health risks of loneliness. They can be just as high as the health risks of obesity, of smoking, of physical inactivity, of excessive alcohol consumption. And that can lead to an increased risk of stroke and heart attack, as well as depression, anxiety, and suicide, says Mayo Clinic's Dr. Amit Shah. It's not just it would be nice to have friends sort of a thing. It is actually something that we know that chronic loneliness, especially, can really impact the health of people. While loneliness and social isolation are found in all age groups, people over 60 are most affected, and it can compound other health issues. For instance, if you've fallen and you're socially isolated, how does anyone know that you were down with a hip fracture if no one's ever been checking in on you or you're socially isolated? There are many ways to address these issues.
And I'm going to switch it back to Miss Angela so she could talk to you guys about confidentiality.
Thank you so much, Taisha. So, as a My Phone Buddy, you will have access to client information that is personal and confidential. They may share what happened back in the day, or they may share some medical diagnosis with you. But please know that the information that you receive is confidential. And we're going to ask that if you would read and volunteer confidentiality and non-disclosure statement that pledges your understanding of the commitment to honor the policy. Now, if staff should determine that there was a breach of confidentiality, you may be terminated as a My Phone Buddy. We don't want that to happen. So we just ask that you would just keep all things confidential. Thank you. Now, let's start talk about the calling procedure. Now, our MoneyMe software replaces the My Phone Buddy monthly check-in. At one point in time, Ms. Carol, I don't think you know this, but we were asking the volunteers to let us know how many clients they contacted within a month. And it was on the 10th of the month that we were asking for those reports to be submitted. But now we don't have to worry about that because life gets a lot of things start going on, and sometimes we forget. So you don't have to worry about it now. So this program actually utilizes the MonaMe telephone reassurance system to streamline operations. The MonaMe assigns volunteers to clients, notifies volunteers when new call requests, and it masks the numbers through a central phone system to protect the personal contacts. So you may have experienced one of your clients who you've called to let them know that you were en route to delivery. You may get a call back at 10 o'clock that night. With this system, it will not call your phone directly. They will be able to leave a message through the system. So, and it's also going to track the call history and the duration of the call. It's going to collect feedback. So, a lot of things you won't have to worry about as far as reporting, because at the end of the call, we will have the information that we need.
All right. Is this where I can step in, Angela?
Yes.
All right. Perfect. So let me share screen. Okay, so I want to walk through how the My Phone Buddy system actually works with Money. So MIPhone is going to match you with your volunteers or with your clients. And then both volunteers and clients are going to dial the same number. So in your case, it's going to be 901-441-7990. And you're going to use the same number to reach each other. And when the call happens, it's going to ask you to choose which person you want to connect with. I'm going to show you examples of when you have nine or less people or when you have folks who have the same name. We'll go through those scenarios in a bit. But when they receive that call from you, it's actually going to call using the caller ID My Phone Buddy. So they should be familiar with it, or maybe they've already saved the number. And the final thing to call out is that your call has to last more than 2 minutes in order for you to get a feedback form via text or via email. And depending on your preference, you can let Angela know and she can make sure that you get it
I have
via text or
to
email.
interrupt for a second. I have a phone call I have to take, and I'm on my phone.
Hmm.
Sorry.
No worries. Okay, great. Let's continue. Or would you rather stop? I think we can share this out with everyone.
Mm.
Okay. All right. So Uh, the key benefits, which Angela has already hinted at, is that it protects your personal information. When they call that number, it will reroute to your phone number, but it doesn't share your direct line. And there's only one phone number that everyone needs to keep for each other, so you don't have to save everyone's names and things. And the system is automatically tracking your hours and all the calls that you're making, how long they took. And if you have any issues, then just let staff know. All right, so here's an example of when you are matched with nine or less people. So the volunteer here is named Julie. And so Julie, the volunteer, is going to dial that MIFA phone number. And you're going to hear a message that says, "Thank you for calling the Metropolitan Interfaith Association. Press 1 to connect with Dustin, press 2 to connect with Jane, so on and so forth." And then it also gives you press 0 to connect with MIFA directly, the office. And so this is the outcome. If you press 0, then the MIFA phone rings. If you press 1, then Dustin's phone will ring. And again, it'll display my phone buddy on the caller ID. And if you press 2, it'll call Jane. Then there's the event that you might be matched with 10 or more people, but you're going to take the same process. The difference is that you are actually going to be asked to say the first name of the person that you want to reach, or you can also type it in. And so once you say the name Dustin, it'll automatically call Dustin's phone, and the same thing happens where my phone buddy displays on the caller ID. And the same thing happens if you were to say or type the name Jane. Here is the feedback form, Carol. I know this has to be super tiny, so you won't
Yeah,
be
I
able to
can't
see it
see the
well.
screen, and I also am
Right.
having some trouble hearing all of a sudden.
Oh no.
Yeah, your
Can everyone
voice
else
is
hear me
getting
well?
dimmer and dimmer.
Muffled. Oh no. Well, the good thing is that we have this recorded, so you'll be able to see this after. Carol, this is recorded, so we'll send this out after as well. All right. And so the feedback form has 5 questions for you. There's the first question, how would you describe the client's mood during the call? It's multi-select. Second question is, did the client express any concerns about their health or well-being? And does the client need a wellness check, which Angela and Taisha will define a little later? Do you have any concerns about their health and well-being? And then a few others. But again, you won't receive this survey unless your call is more than 2 minutes. Okay, now I want to get into some of the frequently asked questions that we have. So the first one is, will the phone system be spying on my calls? And I want to assure you all, we do not listen to any of the conversation you're having. This is strictly monitoring how long the call was and making sure that we send you a survey. So we are not listening in on your conversations. Second question we get often is, can I leave a voicemail? And yes, you can. The phone number behaves like a regular phone number, so you can leave and receive voicemails as usual. And if you leave a voicemail, just be sure to, again, provide the MIFA phone number and not your personal phone number for your callback. Next one
Okay.
is, if you called the number and were immediately forwarded to the MIFA office, there are 2 reasons that this may have happened. The first is that you need to call from the phone number that MIFA has on file. So you cannot switch between your cell phone and your landline. You have to use the same phone number. And the second one could be that your number is not listed. Maybe you don't want people to see it. And so you'll have to temporarily unmask your number by dialing *82 first in order for our system to recognize who's calling. Next question is, after I pressed a number to connect with my client, the call disconnected. If this happens, there are a few reasons why. It could be that the client's line is busy or that they saw your number, maybe they didn't recognize it, even though it says my phone buddy and they don't answer, or they may not have good cell reception, or you may not have good cell reception. So few possibilities. But if you have any additional issues, please let the staff know. Next thing is, what if I'm matched with 10 or more people and some of them have the same name? In that event, you're going to say or type their first name and then last initial, and the system will help guide you. What if I don't make the selection right away? Will the session time out? Instead of hanging up, it's going to actually just have a looped message. So it's just going to ask you again and again, who would you like to connect to? Press 1 for so and so, or state their name or type their name. And it's going to wait for you to stop talking before it actually times out. Those are all of the questions that we usually get. But Carol, do you have any questions if you heard most of that?
Mhm. Uh, yes, one thing that occurs to me is if you leave a message for the person, I suppose that you're hoping to contact them. So why would you give the MIFA phone number
Mhm.
for the
You,
callback?
Yeah, sorry. You're gonna give the My Phone Buddy number. So that 901-44.
Oh,
Yeah.
okay.
Yep. So
Okay.
exactly
Okay.
that My Phone number. Yeah. But
All right.
that's a good clarifying question. Any other questions, Carol?
I'm not sure. I'll have to see how all this works.
Yep. Yeah, for sure. And we'll be here to answer those questions. So, all right. That is all that I have. I'll hand it back to you, Angela and Taisha.
All right. We're going to just go over the calling procedures and reporting. Now, we ask that you when you get your list of my phone buddies, you all will agree on a time that works best for you. It could be, it doesn't matter if it's on the weekend. It could be between, but we just ask that it's between the hours of 9 and 6. We know that some of our clients go to dialysis on Monday, Wednesdays, and Fridays. They may have a grocery store on Tuesdays. Anyway, their schedule may be busy, and yours may be busy as well. You may be traveling. So we just ask that you all come together on a day that works best for you. We say that Thursdays and Fridays as our preferred days where there are fewer meals delivered, but it doesn't matter. Whatever day works for you is perfectly fine with us. Now, we ask if the client does not answer the phone, just leave a voicemail. And you don't have to call right back, but if you can just call back at a different time, that will be awesome. And then if the call is unanswered after 3 attempts, then you can just report that to us, and we will most definitely have our team to follow up.
All right, maintaining healthy boundaries. Boundaries help maintain focus on the individual's needs by keeping the conversation on topic and ensuring that the volunteer is providing the best possible service. So, why do boundaries matter? It ensures a professional and supportive relationship. It protects both the volunteer and the client. And again, it helps maintain focus on the individual needs. But there are some key points to remember. Set clear time limits for conversations, keep personal information private, redirect conversations to stay on topic, and politely decline inappropriate requests, and of course, maintain a professional demeanor. And we will get into how to politely decline requests and how to redirect conversations. So, volunteers will refrain from providing health-related advice. The My Phone Buddy program is not a referral service, telemedicine provider, or a medical alert service. If medical advice is requested, do not offer any advice, but encourage the client to contact his or her doctor. And here are some conversation starters. What was your first car? What's something that you've always wanted to try? And I will send this out with the recording of this presentation. So sometimes our seniors may share things that are emotional or outside the scope of what we can help with. It's okay to feel unsure in those moments. The key is to listen with empathy and gently guide the conversation back to a supportive place. For example, if someone shares a difficult story, you could say, "That sounds like a tough situation. How can I best support you with this?" These phrases show that you care without overstepping your role. Requests for medical advice. This is a very important boundary. Even if you have personal experience, we never want to give medical advice to our clients. Instead, we can say, "I'm not a doctor, so I cannot provide medical advice, but it's best to talk to your doctor if you have any questions." This keeps the conversation safe and respectful for both you and the client. Dealing with inappropriate requests. If a conversation ever becomes inappropriate or makes you uncomfortable, it's okay to set a boundary. So here are some phrases that you could use. I'm here to listen, but I can't provide that kind of help. I'm here to listen, but I need to keep our conversations appropriate. Financial requests. Sometimes clients may ask for money or financial advice. It's natural to want to help our clients. So try saying, I'm not able to help financially, but I am here to support you in other ways. And always, under no circumstances are you permitted to accept money from a client. If a client asks you for money, please report it immediately.
Now, in the event of an emergency, volunteers must inform the client that you're going to call 911. And we ask that you hang up and call 911 immediately. And then after reporting, we ask that you will just follow up with MIFA, and so that we can most definitely follow up appropriately after the call has been made.
Excuse me, but how would 911 help? Well, they don't know where the person is.
But that is a good question. So that's a good question. And you know what? We need to get that information to you because you know who your clients are as far as when you deliver the meals. So thank you for that because I need to rethink that because you don't have their address. And so let me get back to you that on that one, Miss Carol. But thank you because I didn't even think about that. So please keep your comments, your feedback coming. But not unless anyone else out there have any suggestions right now. So if there is a 911 emergency, and Miss Carol need or one of the volunteers need to reach out and they're unable to give that information, should because we have the client information, the phone numbers and the address, is there a way that we can, well, should we send that to the phone buddies? Do we need to put a pin in it, think about that, follow up?
Yeah, let's put a pin in that.
Okay. Miss Carol, thank you. Thank you. Thank you. See, that's why we need you.
Mhm.
We need the volunteers because you all come up with some good suggestions. Thank you. So we're going to follow up, okay, Miss Carol?
Okay, thanks.
And that is a perfect segue into wellness checks. A wellness check is a public service where a police officer visits a person's residence to ensure their well-being, often requested when there are concerns about a person's safety or health.
Hi, Miss Bruce. Thank you so much for joining. Now, inclement weather. Now, during inclement weather, you know, we had a lot of snow and ice. If MIFA is unable to deliver the meal, we will send out a call through our one call system, letting our clients know that they are to eat their emergency meal that they had already received. So we just ask that if you would like to follow up, that is perfectly fine, but do know that they will automatically receive a call from MIFA letting them know that we would not be able to deliver because of inclement weather. So we ask that you keep your questions coming. We appreciate you, appreciate your time, and if you can think of anything now, and Ms. Bruce, I do apologize. The link that you said, we're going to send out the PowerPoint, and then I will follow up with you if you're available immediately after this. I will give you a call back. But we just thank you for tuning in. And Ms. Carol, since you were here for the duration, do you have any additional questions, any comments, feedback, things that we can make sure that this program is a success?
Well, I guess what happens next?
Well, thank you for that. So we have your profile and we also have the client's profile. So since you have gone through the training, you should receive your phone buddies. I'll say next week, you should be linked together. The program officially kicks off July 1st. So if you want to test the system out before then, that is perfectly fine. But just know next week I'll most definitely have you and your Neil's clients connected. Your phone buddies, you will be
Hmm.
connected.
And so I think I missed, and maybe this is in the PowerPoint, but how many times should we call a
You'll
person?
be, how many buddies will you be assigned?
No, how many times, how often should we
Oh, just
call them?
once a week, if that works for you. Some of them may want you to call, or you may want to reach out once a week, but we just really require that you reaching out. You reach out once a week.
Once a week. Okay.
Yes, ma'am.
And if we are traveling and we can't call for a couple of weeks, do you need to know that, or how does that work?
Well, that would be great if you let us know. And you can also let your client know in advance, like you do with your meals, right? I won't be here.
Mm-hmm.
So don't expect a call from me. But I will be thinking of you or however you want to communicate that. But that is
Mm-hmm.
understandable, yes.
Mm-hmm. Okay. And so we'll have the phone numbers of the people that need to know if we're have some reason we can't make calls.
Yes, ma'am. You use that same system through that my phone buddy, through the Mona Me. You can actually reach out to them through that system and they'll know. If you have to leave a message and let them know that you'll be traveling, that is perfectly fine.
I see. Okay.
Did I say that right, you all? Is
Yes,
that right?
yes,
Is that
ma'am.
right?
Well, all
All
righty.
right. Thank you so much. So, Miss Carol and Miss Bruce, I will most definitely reach back out to you. Appreciate your time. Appreciate what you all do to support MIFA, and I hope you have a wonderful rest of your day.
Yep.
Y'all have a great
Thank you so
weekend. Thank
much.
you.
Bye.
Thank you.